workers' union NEHAWU is today holding a media briefing coinciding with the organization's Day of Action in defense of community healthcare workers at the Labour Court in Johannesburg. Now, this Day of Action will form part or will take the form of a picket, a demonstration, if you like, which will be directed at the National Health Department after having failed to demonstrate justifiable reasons why community health workers are kept in recurring fixed-term contracts. At least that's the claim from the union itself. Watching developments for us is Katlego Legodi, our economics reporter, joining us now live from Braamfontein. It's already a hive of activity there, Katlego, but hopefully you can place for us the claims specifically made by NEHAWU and how they're hoping the situation will change on the other side of this picket.
A very good morning to you, Ayanda, and to our viewers at home. You're right, already a hive of activity here outside the Labour Court in Braamfontein. This is where we're seeing members of NEHAWU just coming through just to picket here outside on a day of action. They've approached the Labour Court, Ayanda, because they have not gotten really joy from the bargaining council, and now they're looking at the Labour Court to try intervene here. Here we're talking about 46 or 47,000 of these community healthcare workers. They've been approaching their union, NEHAWU, to try and intervene in converting their fixed-term contracts into permanent contracts. Of course, they are arguing that there are benefits that are attached to permanent employment, and some of them even saying here that really the cost of living is too high, and what they're getting here is a stipend, and they wouldn't want to get a stipend perpetually, but they would want to see this fixed-term contract converted into permanency. Most of them are really looking toward this process because the bargaining council said that and awarded the Department of Health, or ruled in the Department of Health's favor in saying that they should continue with keeping these workers on a fixed-term contract. But NEHAWU here, supported by the SABC and COSATU, just looking towards the court to intervene in this regard. I'm going to bring into the conversation with us now the NEHAWU president, Mike Shingange, who'll just give us a sense of this battle. It looks like it's been years of you fighting this battle for these community healthcare workers to be employed permanently. Looking to the Labour Court, maybe give us a sense of why you decided to bring it here.
Thank you very much. Good morning. Yeah, it's true. It has been a very long battle. We came to the Labour Court, of course, because we didn't get joy in the bargaining council in the arbitration. So this is one of the records that we're pursuing in our resolve to fight for decent job in this country, because you will know that the services that have been provided by this cohort of workers, it's a permanent in nature. Wish away the services of community healthcare workers, but they continue to be exploited. They have no benefit, they have no job securities. Many of them retire or die without any pension at all. They have no medical aid. They work in a very unsafe environment. They don't have safe transportation, but they're just earning meager salaries. So our view is that for as long as the Department of Health, particularly at the level of primary health care level, you're going to need the community healthcare workers. You should employ them permanently. That's what this country, the developmental state is about. It's about job security and decent job.
One of the things that Advocate Ronnie said when he was awarding this order in favor of the Department of Health was to say that this has been bargained for, even taking it to the 2018 bargaining agreement to say the community healthcare workers enjoy security from that bargaining, that it should be all-encompassing. When you look at it, basically, they're shielded and protected from the cost of living.
That's incorrect. Actually, that's why we're here. We're seeking a record, because there's no collective agreement that has been signed that regulates their employment as for permanent. The Resolution 1 of 2018 that we have signed was just about beginning a process of absorbing them permanently. It had a time frame. That time frame has lapsed. It was 3 years. It was extended again in 2023, just to ensure that they keep being there while the department and Labour are trying to find mechanisms and the levels upon which they must be absorbed. So basically, why we went to that arbitration was because of that Resolution 1 of 2018. It has actually lapsed and it was not implemented. So there's no agreement that exists now that says that these workers are appointed permanent, number one. Number two, the current agreement that is there that seeks to facilitate the negotiations to absorb them doesn't provide any protection in terms of the benefits that a permanent worker gets in terms of medical aid, in terms of pensions, in terms of job security, and so on and so on. So that's why you know that you could have said, because the Act gives about 8 reasons why you must keep workers beyond 3 months. Because remember, in this country, there has been a court ruling about that you can't keep workers on a temporary basis over 3 months. Otherwise, you have to employ them because you have demonstrated that actually you need their service permanently, but also you have created an expectation for them. Our point is that this cohort are the core of working door to door and providing healthcare services to our people. They are performing a healthcare services, but they are not working for the Department of Health. They are working for NGOs. They are working for some other funders out there. They are being exploited, but they are working for the public health system.
What would make you happy? Because we know that at the center of what is happening here is the Labour Relations Act. You're right to say that there have to be justifiable reasons from the employer why then they're continuing to keep these workers in contracts. What would be your expectation from this particular court?
Firstly, is the interpretation of that which the advocate has argued there in terms of the collective agreement that exists. But secondly, you can't have a state, a government that enjoys services from people that do not work for them. You can't have a state, a government that enjoys services that is permanent in nature with people who are temporal. You can't have a state that has got other categories of public health that are working, that have got protection through the labor laws, that have got the rights that we have, and then another categories that are this one, that are the most vulnerable and servicing our people on the ground, but they are not protected. You can't have that disparity. That's what we are trying to fight here in this court.
All right, Mr. Shingaga, thank you very much, sir, for your time. They're going to be moving inside, Ayanda, in terms of what is expected here. The court proceeding expected to kick off at 10 o'clock, but you see most of them are already starting to arrive here for a picket, and we know very well that these are community healthcare workers that were at the center of ensuring that during COVID-19 they do the screening, they do the testing, and Kasatu and NEHAWU also saying that there are justifiable reasons why they should be employed permanently, and they're now looking to the courts.